Welcome back. National Sleep Awareness Week is this week, March 2nd to the 9th, and we're talking about one of the most prominent sleep disorders, sleep apnea. And here to talk about that and raise awareness is Nine Health expert Dr. Payal Kohli. Good morning, Dr. Kohli.
Good morning, Natasha.
So first question, what is sleep apnea?
You know, such an important question. A lot of my patients who have it don't even realize they have it. So sleep apnea basically means apnea while you're sleeping, which is lack of breathing. And there's two types that you can have. One is called obstructive, which means something is obstructing the air from getting in, whether it's your tongue, the muscles in your neck, but when you lie down, everything relaxes and it causes an obstruction. That one most often presents with snoring. The other is called central, which means that your brain forgets to breathe. And this can happen especially if you drink alcohol within a few hours of bedtime, where the breathing centers in the brain just forget to tell you to breathe.
Yeah, so how do you find out you have it and how do you diagnose it?
So a lot of times your partner is the one who will first tell you, and they'll say, oh,
too much snoring.
Too much snoring, or oh, you stopped breathing there. You startle yourself awake snoring, and you think it's the snoring that's woken you up, but it's actually the lack of oxygen that sends your body into a stress response that wakes you up. Sometimes it's more subtle though. Sometimes you wake up in the morning with a headache, you wake up feeling like you haven't slept, you have a dry mouth, you're irritable or fatigued all day long, or you have to take a nap during the day.
Yeah, so I mean lack of oxygen to the brain while you're sleeping. I imagine a lot of complications from this.
Many complications. Of course, the premier one being heart attacks and strokes, also car accidents because you're tired, diabetes, liver problems, metabolic disease. So, you know, if you are concerned that you or your partner may have sleep apnea, talk to your doctor about whether you should get what's called a home sleep apnea test, where you just basically wear an oxygen probe and a respirometer while you're sleeping. It's a little sticker that measures your breathing, or a nocturnal oximetry, which actually measures the oxygen all night long.
So those are the treatments for it?
Those are the tests to tell if you have it. And so once you've decided whether you have it, and usually we treat anyone who has more than mild. So if you're moderate or severe, if you're mild, your treatment can actually just be not sleeping on your back. So I tell some of my patients, the poor man's treatment is to tape a golf ball onto the back of your pajamas.
So you don't automatically fall
roll
into that.
onto your back, exactly. But if you're moderate or severe, then you have to think about CPAP, which is continuous positive airway pressure, which actually can push air in, which works really well for obstructive sleep apnea. If it's something in the brain, they sometimes use medications that can change your sleep centers in your brain.
So probably good to pay attention to your sleep and go to the doctor if you see something wrong with your breathing.
Very important. And a lot of times people present with high blood pressure or atrial fibrillation or some other complication of sleep apnea as their first presentation. So just keep that radar up. If you're feeling like when you wake up in the morning you're not rested, you could have sleep apnea.
All right, good to raise awareness about this. Dr. Kohli, nice to see you. Thank you.